Botox. Let's talk about it. Do you know the difference of Botox? Do you think it sounds crazy? Do you do it all the time? But you want to know a little bit more about it. We're talking about everything today with Dr. Ward. Dr. Ward is here. Also, Shalia. Hi, Shalia. How are you?
Good. Thanks for having me.
Good. So let's introduce Shalia first. We're getting to know so many more of your team members.
I'm so happy because we have got the very best team. They're so good. And I'm really happy to be able to introduce Shalia. Shalia is a PA. She's been with me about 2 years. And she has just been such a blessing to me personally, but to our patients. She takes such good care of them. Everybody loves Shalia. We just can't, she can't avoid it.
Look at her smile. You're like, how could you not love Shalia?
She's smart. She knows everything. And she's got this thing that maybe you can't teach, which is this amazing aesthetic sense. Like she can look at a face and just knows what they need. So talented.
And I also love when I look at somebody like you and I'm like, I want my skin to look like hers, porcelain. So it's always a good thing. Well, Dr. Ward, let's talk about Botox. Botox is the common term that everyone uses, but there are different kinds.
Yeah, so there's 4 or 5 different brands of botulinum is kind of the more generic term. We all say Botox. It's kind of like Kleenex, you know, like you don't care if it came from Costco or whatever.
True.
It's still Kleenex, right?
There you go.
So we often call it Botox. We typically use the Dysport brand of Botox.
And why is that?
Well, I did a study a few years ago when I was full-time at the university. There was a randomized controlled trial published in JAMA Facial Plastic Surgery comparing the 3 available types, and we thought that it gave superior results.
Interesting. So does that mean it lasts longer?
Lasts longer, starts earlier, and just in terms of the clinical effect, it seemed to work better.
Good to know.
So that's what we like, that's what we use.
So Botox Dysport, obviously being used for looks, but also being used for migraines and different treatments as well.
Yeah, so it's, you know, the way that the medication works is it decreases muscle contraction. You know, so whether that muscle contraction is like right here causing us to scowl or right here causing crow's feet or whatever, it helps decrease the contraction. Same thing happens like for our muscles here, like, you know, our masseter muscles that we chew with. It can soften those. It can decrease the pain that we maybe experience because we clench our teeth too much.
How does it work? I mean, what is it doing? You know, what's my brain telling the muscles to do or not do?
So, you know, like whenever the brain gives a signal to contract a muscle, there's a nerve signal that goes down to that muscle. Botox is kind of like taking the phone off the hook. So it can't ring.
I remember that.
So it stops the signal from getting to the muscle. So it's still there, like it doesn't affect the muscle. It's just that nerve can't give the signal through, so you just don't contract it.
Those of us that actually had a phone that could be left off the hook understand that. The kids that have a cell phone, ask your mom and dad to explain that. So, Shalia, let's talk about some of the patients that you see and who is the appropriate person to have Botox or Dysport done?
That's a great question. Really, anyone that has skin. That would be my recommendation.
You're good.
If you're, you know, aging and starting to notice some of the wrinkles come through, that's a great candidate for Botox. We can help reverse a little bit of that, prevent it from getting worse. But even those who are younger, maybe not realizing so many of those wrinkles quite yet, use it as prevention. I mean, you will thank yourself 20 years from now when you look, you know, this much better than the people you grew up with. You're going to thank yourself so much that you started early.
You said the key word. You said prevention. When I first started, I thought it was a total lie. I was like, it's not going to, you know, it's not going to this and that. But I've noticed that I've actually been doing it less. It's like my muscles are learning. Is it true?
Yeah, it's true. As you're keeping up on that dosage and taking care of yourself regularly, the muscles are getting weaker and weaker. Kind of like if you skip going to the gym for 6 months, your muscles are going to get weaker.
Makes sense.
In the same way, you're not going to be able to create those wrinkles as strongly as you used to.
So basically, you should start doing it today. I started years and years ago, and I've been a fan, and it does help with migraines, which I'm also a big fan of. So if they want to come meet either of you or any of your team members, they can come. You have 3 locations.
3 locations.
Okay, and they are where?
City Creek, Mountain View Village in Harriman, and then in Cottonwood Heights.
Perfect. You can go any of those locations, come in, meet them, and chat with them. That might be the best way, is just to do a consultation so that you can feel confident and comfortable in what kind of treatment you're going to be doing. Thank you so much, you two.
Thanks.